Dr. Sheila White.
And I'm Dr. Jorge Hernandez.
We're with White Chiropractic in Burnsville. The purpose of this video is to explain our SRT program. If you're watching this video, you've either been told by one of us doctors here that you could be a good candidate for SRT, or you're seeing it on our website and are curious about it. First, I want to ask you, if you had the ability to restore your spine to a healthier condition, reduce the degeneration of the discs, strengthen the supporting ligaments, tendons, and muscles around the spine, and reverse damage from years of bad posture and or results of injuries, stress, bad nutrition, dehydration, and the overall aging process. Would you want to know how? If that intrigues you, then let's talk about this wonderful program and see if it could be a good fit for you.
So now we'll be asking questions that usually people ask us about SRT. Dr. White, what is SRT?
Well, SRT is a very specialized posture and spinal curve correction program that's inspired by the Pedibond technique, which has been around since the 1960s. The SRT system will teach you how to help yourself in improving your posture. The program consists of evaluating which exercises are right for you, and this is based on exam and x-ray findings, setting up an individual program based on your specific needs, teaching you home-based exercises to improve your posture and spinal curves. You're given a kit of equipment to do these exercises at home with, and following up to monitor your progress until you achieve optimal correction, and then setting up a maintenance program to prevent the poor posture patterns from recurring. To understand how SRT works, we first need to understand more about why we need it, and that comes with discussing posture and spinal curves.
Dr. White, what should proper posture look like then?
Well, to answer that, let's first talk about spinal anatomy and alignment. Proper alignment of the spine from the back view, the spine should be in a nice straight line. If we look at it from the side, there should be 3 healthy curves. These curves are important for shock absorption to allow the spinal cord to be relaxed within the spinal column. That shock absorption is very important to protect our discs, our vertebrae, and our nerves. If I were to draw a line along the side of the body, we should be able to have our head balanced right on top of our spine. Should be able to draw a line from the ear to the shoulder to the hip to the side of the ankle. And the weight of the head should be balanced directly on top of the spine so that there's no stress on the supporting structures. One main purpose of the spine is to protect the spinal cord, which acts as a pathway for messages between the brain and the body parts. The spinal cord sends motor commands from the brain to every cell, tissue, and organ, and receives sensory information from the body parts back to the brain.
Dr. White, why is posture so important?
Well, you know when you were younger and your parents told you to sit up straight and have better posture? Well, you might have thought that was just to look better, but there's actually far more consequences to bad posture than you might realize. With poor posture, we usually find that the head is too far forward, away from the shoulders, and what happens there is the weight of our head is forward, so our body's not going to let us tip over. It's going to compensate by bringing our weight back. And now we've got stress on different muscle groups that are not meant to be. So we'll talk about that shortly, about the consequences of having altered posture patterns. But here's something to think about too. When we think about the spine, if that head goes too far forward, think about the spinal cord sitting inside the spine. The spinal cord actually gets stretched or tethered when that happens. And what that'll do is slow down the nerve impulses coming down from the brain and back and forth from the body parts. It's similar to having a kink in a garden hose that would slow down the stream of water coming out. Poor posture has the following consequences. It contributes to headaches and migraines because the muscles in the back of the head and neck are constantly tense when the head is in the wrong position. And there's also a stretch on nerves and blood vessels that go to the brain, and this can contribute to migraines. It causes neck and back pain and chronic muscle tightness because our body is forced to depend on the wrong muscles for support. It can cause stress to the TMJ, the shoulders, the hips, knees, and feet due to all these areas having to compensate for the center of gravity being shifted. It can decrease lung capacity, heart function, and this is because the abdominal and the chest cavities get compressed when we have slumped posture. So I want to show an example of this. So try this when put your head forward away from your center of gravity and slump your shoulders. And now I want you to take as deep a breath as you possibly can and think about the air, how much air you're bringing into your lungs. Okay, now you can breathe out. Now stand up really straight. Put your head back over your shoulders, have good posture. Now take that same deep breath and pay attention to how much air you take in this time. It's a lot more,
wow.
right?
Yep.
Yeah. So
Big time.
think about that. You need oxygen to all of your cells. So what do you think would happen if we don't have enough oxygen to our cells? Many things. Fatigue would be a big thing, but it actually could put more stress on our heart. And there even is a link to high blood pressure and poor posture. Poor posture decreases energy level, again, because of less oxygen to the cells. Plus, more energy is expended when there's stress on the spinal cord, slowing down the nerve impulses passing through. It contributes to early arthritis. We'll talk more about how that happens shortly. It increases risk of disc herniations and disc degeneration because discs want to shift backwards when the back is slouched and the curves are lost. It can cause a buffalo hump to develop in the upper back and lower neck because the head is too far forward. And if you or someone you know has this, that's not an appealing thing to have. And we do see people improve with that if they came in originally with that, and also could prevent it for in the future. Poor posture makes you look older. There was actually a study that people had to guess a subject's age based on their picture. And the one picture of the person, they had good posture, and one they had bad posture. The average was that the person was guessed to be 10 years older than they really were when they had the poor posture. It contributes to balance issues and dizziness because spinal proprioception may be altered, which is how you tell where your body is in space. And also the blood flow to the brain can be reduced with forward head posture, contributing to dizziness. It slows down and interferes with digestion. So if you slouch, it will compress the abdominal cavity, and that could lead to acid reflux and also constipation because of weak abdominal muscles. Nobody wants that, right?
Not me.
All right, it also can cause bladder problems such as incontinence, again, because slouching increases the abdominal pressure and puts pressure on the bladder. It increases fall risk in older adults because when your center of gravity is shifted, you're not as stable. Amplifies injury risk during sports and physical activity because muscles are imbalanced and you're more prone to injury. Lowers self-esteem and makes you look less confident.
So what causes forehead posture and the loss of spinal curves?
Well, our body takes on the shape of what positions we're in for long periods. So a big reason would be hanging our heads over our phones and also sitting at a computer for long periods of time, having sedentary jobs, gaming would be a really big one too. And injuries like whiplash can also damage ligaments in our spine that can cause the normal curves to be lost. Poor posture and lack of exercise to keep our spine moving are also big contributors. This slide shows the effect of forward head posture. So if our head weighs approximately 10 to 12 pounds, every inch our head goes forward away from our center of gravity, it's like 10 extra pounds of weight that our body has to hold up. In this picture, the model on the right shows there's 3 inches of forward head posture. So the head essentially weighs 42 pounds for the body to have to support. This extra load's a reason for ongoing patterns of muscle tightness, headaches, numbness, pain or tingling in the arms, and then other problems we just discussed. Also with forward head posture, there's a heavier load on the spinal joints because of how the muscles are in a constant state of tension. The body's way of compensating is to remodel the bone and lay down more bone to make the area stronger. Well, this turns into calcium deposits or bone spurs and leads to early arthritis and disc degeneration. It also means a much higher chance of disc bulges or disc herniations because the weight of the head is not over the shoulders and the discs want to migrate backwards as a result. So as you can see, better health starts with improving and restoring posture. Posture is reflexive and involuntary, meaning it can't be improved by just sitting up straight or with adjustments to the spine alone. We must correct postural changes through the reflexes, and it requires retraining of the brain and the body and conditioning of the supporting structures. Posture muscles must be strengthened through isometric exercises, which we'll be demonstrating. and encourage proper loading of the spine to avoid early degeneration and stop or even reverse current disc and joint degeneration. This is where SRT comes in. Now let's talk about how this process works. This is the SRT area of our clinic where our patients do some of their exercises. So after we evaluate a patient that's an SRT candidate with a physical exam and look at their initial x-rays, we schedule a set of weighted stress x-rays as part of their stress test. Let's walk through an example of how this works. The x-ray on the left is what a normal cervical x-ray should look like. It shows a side view with a normal neck curve, allowing for great shock absorption, and the head is right over the center of gravity. On the right is one of our SRT patients initially that had about 1.5 inches of forward head posture, and she had also lost 90% of her cervical curve, and it's nearly completely straight, which means there's decreased shock absorption in her neck, and she has some early degeneration to her discs.
You mentioned stress tests. What does that involve?
Well, it consists of SRT warm-up exercises, which we'll show you a demonstration of shortly, spinal adjustments, and then the weighted stress x-rays. The stress test will determine the weakest and most injured areas to your body and will determine your course of care. So let's talk about the postural weights we use. In this slide, it shows a patient with weight strapped to the front of her head, and in this case, to the back of her hips also. What we're looking for here is if we attach weights on certain areas of the body, can we force your muscles into restoring your curves and improving your posture pattern? These are the x-rays of the patient we saw earlier. Her initial x-ray on the left showed her head was too far forward and she had very little curve. With the stress test, we strapped a 1-pound weight to the front of her head and had her wear that for a few minutes. The weight basically increases the weight of the head, and we see if her body responded to that weight by creating a reflex to pull her head back and create a better curve. This would be similar to carrying a 5-gallon pail of water in one hand. Your body reflexively shifts to the other side to counter the weight added. Well, if we see that her curve and forward head posture improves, which hers did, her head was brought back and the curve in her neck improved by several degrees. Well, this means that wearing the weights will immediately be part of her SRT program. If we don't see improvement, it just means that there's some conditioning to do before we use the weights as part of their program. To show you a glimpse of what's possible, we also show a picture on the right, which is the same patient 3 months into her program after she's become stronger. The next stress x-ray is 2 pounds of weight on the head, and look what it does. It completely corrects her forward head posture, and her curve is 30 degrees increased from her initial x-ray. This is amazing because it shows that she should expect to get full correction as she continues on her SRT program. Now that we've done all the tests, we build the patient's home exercise program. The basic program consists of 3 main components: the 4 warm-up exercises, wearing the postural weights, and spinal molding and isometric exercises using the fulcrums. Dr. Hernandez will be showing a brief demonstration of these, and of course we will coach you through all these exercises in the clinic until you're proficient. Then you'll do them at home when you've mastered them. The first part of your home program is the 4 warm-up exercises. The 6-way cervical stretch. We do this one for 3 minutes. There are 3 different head positions done on each side to stretch the front, side, and back of the neck. The 6-way stretch is necessary for stretching chronically tight postural muscles so their muscle memory can be removed. It restores normal function and creates new muscle memory. And we do this one on a vibration plate in the clinic to accelerate muscle fatigue. Chronically tight muscles can relax better with vibration. Repetitive cervical traction. We do this one for 3 minutes. The benefits of cervical traction are that it reduces stress in the neck and aids in the prevention of and recuperation from injuries, assists in the healing of disc bulges and disc tears, helps restore the normal cervical curve and relieves tension on the spinal cord, increases function of the cervical vertebrae to stimulate endorphin production, which are chemicals that block painful stimuli. It helps rehydrate degenerated discs. Keep in mind this does not correct the cervical curve alone, but it prepares the tissues to accept the neck corrections. Now we have the wobble chair. This one we do for 5 minutes. The benefits are that it improves low back range of motion, rehydrates the discs, lubricates the spinal joints, aids in repair of disc bulges and herniations. It also circulates cerebrospinal fluid, or CSF. Now we have the thoracic roll. We do this for 2 minutes. The benefits are that it relaxes and reduces tension on the thoracic spine while warming up the muscles. It increases movement in the most fixated areas of the spine, allows for better movement in the cervical and lumbar spine, and it breaks up scar tissue in the thoracic spine. This one also would help improve the cerebrospinal fluid flow. The next and very important part of your home program is wearing the postural weights to change the muscle function. The benefits of the weights are that it helps correct forward head posture by retraining the muscles, improves spinal curves and overall posture, and the body weighting system will help you hold and stabilize your correction. It helps accelerate your results, and in many patients we need to add some support while wearing the weights until your muscles get stronger. That's why we would use the posture strap. The posture strap provides resistance for those with weak neck muscles when using their weights until their postural muscles strengthen to hold the proper position for the therapy. The last part of the home program is spinal molding and isometric exercises of the fulcrums. So spinal molding is done by laying on the fulcrums, which are dense foam wedges, to aid in the posture and curve correction. Sustained forces produced by laying on the fulcrums stretch and change the muscles, tendons, and ligaments while the spine is held in or near its normal curve. It follows the warm-up exercises. Isometric exercises are also done on the fulcrums to recondition ligaments. This will increase the ability for the curves to be improved. In many patients, we also add spinal decompression therapy to their SRT program for optimal results. Spinal decompression involves gently stretching the spine using a special decompression table. It improves spinal range of motion, reduces nerve and disc pressure, and decreases pain and stiffness. Promotes retraction or repositioning of bulging, degenerating, or herniated discs. And it also allows healing nutrients and fluids to flow into the disc to improve hydration to the disc. There are certain expectations we have of you to get the most optimal results with your SRT and decompression program. Hydration and proper nutrients are crucial to rehabilitate the spine. The spinal discs and cartilage in our joints are made up of a gelatinous substance, which is very high in water content. If we don't have enough water getting to those tissues, they get dehydrated and lose shock absorption. This would be like making Jell-O and only having gelatin but no water. It wouldn't have the Jell-O consistency we want. So, water must be present for effective changes to take place if we want to rehydrate discs and improve shock absorption. The human body is over 70% water. This means that your daily intake should be half of your body weight in ounces of water per day to hydrate all your tissues properly. The nervous system is over 90% water. Well, if each spinal disc loses 10% of its water content, you actually could lose permanently 2 inches of height. Dehydration also causes muscles to spasm easily. When it comes to the nutrients, we recommend during our program and for ongoing health, drinking a little salt water to add electrolytes that help hydrate your tissues. We use this with Himalayan sea salt or Celtic sea salt. Glucosamine and chondroitin sulfate, MSM, and hyaluronic acid. These are all important building blocks for cartilage and to lubricate our joints. These nutrients are available in the form of our Chondro Relief Intensive Care from Nutridyne. We also want to have you eat a healthy diet. Make sure you have some foundational supplements like a good quality multivitamin, fish oils, and minerals like calcium or magnesium. This slide shows the phases of care. Initially, we start with the pain relief phase. The goal here is getting out of pain as quickly as possible. Then we move on to corrective care with the goal of getting to the root of the problem. Supportive care is keeping the progress you've made. Maintenance care is preventing those problems from returning. And wellness care would be optimizing your health. Intensive initial care. This is to form new habits with time and repetition. It's to get your body out of crisis mode, restore the function, reduce inflammation and symptoms. We want to be doing adjustments at this stage more frequently, and the frequency will vary based on the severity of the case, but it could be 2 to 3 times a week for those first 2 to 6 weeks. And then your home rehab exercises would be anywhere from 1 to 2 times per day. Now moving to corrective care, this is to improve your function and anchor those new habits. Research on muscle physiology shows that a minimum of 90 to 180 days of rehab must be performed to attain permanent correction of the spinal biomechanical change. We'll do a re-exam every 12 visits to monitor your progress, re-x-ray every 3 months to monitor your structural change, and adjustments are reducing in frequency at this stage. Again, it can vary, but anywhere from 1 to 2 times a week for 4 to 12 weeks. And your home rehab will be 1 to 2 times a day, depending on the case. Stabilization care. This is where it's full rehabilitation. Research on ligament physiology shows that ligaments take 18 to 24 months of rehab to become functional, to hold your spine in place. Adjustments here would be once a week for months 3 to 6, twice a month for months 6 to 9, 1 to 2 times a month for the months 9 through 12. Home rehab exercises here would be once a day for the first 3 to 6 months, and every other day for months 6 through 9, and then minimum of once a week for months 9 to 12, and usually beyond. Now let's look again at the case we saw earlier. This is that initial x-ray again, and another comparison after 6 months of being on SRT and decompression. Her x-rays show 25 millimeters less forward head posture, which is approximately an inch. This essentially means she has 10 pounds less weight for her muscles in the neck and back to hold up. She also had 19 degrees improvement of her cervical curve, and she's about halfway through her program at the point of this video, so more changes are expected. Not only are the x-ray results impressive, but here's what it means to her. She has decreased from daily constant neck and upper back pain and frequent headaches to having periods of 1 to 2 days per week with no pain at all, and the other days the pain is at least 50% better. Her headaches have diminished greatly as well. She has been so happy with her changes that she's recommended it to 2 other family members who are also on the program. We are so thrilled to help patients like these get their quality of life back, and that's why we'd love to help you and your loved ones as well. We've seen many patients that have been on our SRT program that have been able to break through plateaus they've been stuck at for years, even despite receiving great chiropractic care from us or other chiropractors. This corrective care can bring them to the next level of pain relief, better spinal range of motion, and improving their posture. We see their energy improve, they sleep better, and we're just so happy to partner with them in taking their health to the next level. I can honestly say that one of the main reasons I decided to bring SRT into the clinic is that I've seen far too many patients over the years that have progressed to having severe spinal degeneration that could have been avoided if they'd only known how to take care of their spine when they were much younger. Their quality of life by that time is so poor that by the time they reach retirement, they're unable to be active anymore, play with their grandchildren, or other things they would have loved to do with the rest of their golden years. We would love to help you prevent, stop, or potentially reverse some of the degenerative changes that can break down your spine and decrease your vitality. Dr. Hernandez, do you agree?
Absolutely. This will be the difference between choosing when to retire and being forced to retire. It'll also be the difference between being able to play golf, go hiking, biking, traveling to places you always wanted to see, or just sit at home miserable in pain, watching The Price is Right all day long and being unable to do what you want to do.
Well, here are some closing thoughts for you to ponder. Think about what you are unable to do or enjoy because of your current health challenges. In the next 20 to 40 years, what activities would you like to be able to do? Who would you like to be able to do these with? And if your health problems are not corrected, do you think they will get worse? If your goal is to live a life full of vitality and be able to do what you enjoy most in life with those you love for years to come, are you willing to make a commitment to yourself and to your health to make those changes necessary for a strong, healthy body? If that is what you desire, then we'd love for you to join us. We hope you enjoyed our presentation.